Antibiotic resistance is one of the biggest health challenges in the world today. This problem doesn't just affect major global players, it's a growing concern right here in Pakistan as well. In today's video, we'll explore what antibiotic resistance is, why it's a serious issue, how it's impacting countries around the globe, and what specifically is happening in Pakistan. Most importantly, we'll look at what we can do to tackle this challenge.
What is antibiotic resistance? Antibiotic resistance happens when bacteria develop the ability to defeat the drugs designed to kill them. This means the antibiotics that used to work against infections like pneumonia, tuberculosis, or urinary tract infections no longer do. The bacteria evolve, becoming what we often call superbugs, and these infections become harder or even impossible to treat. This isn't just a future threat. Antibiotic resistance is here, and it's affecting millions of people around the world. In fact, common infections that were once easily treatable with antibiotics are now becoming more difficult and expensive to manage.
How does antibiotic resistance develop? So, how do bacteria become resistant? It all starts when antibiotics are overused or misused. When you take an antibiotic, it kills most of the bacteria, but a few resistant ones might survive. These resistant bacteria then multiply, and because they've adapted to withstand the antibiotic, the drug no longer works. Here's the thing, the more we misuse antibiotics, the faster bacteria can adapt. Whether it's using antibiotics for viral infections like the common cold, or not completing your prescribed course of antibiotics, both actions give bacteria the chance to develop resistance. The global impact of antibiotic resistance. Globally, the impact of antibiotic resistance is staggering. It's estimated that at least 1.27 million deaths worldwide in 2019 were directly attributable to antibiotic-resistant infections. This number is projected to rise if we don't take significant action soon. The World Health Organization, WHO, has classified antibiotic resistance as one of the top 10 global public health threats. Countries like the United States, the UK, and India are already seeing an increase in the number of infections that are resistant to multiple drugs. But it's not just happening there. Resistance knows no borders. Antibiotic resistance in Pakistan. In Pakistan, antibiotic resistance is a growing crisis. With one of the highest rates of antibiotic misuse and overprescription, the country faces a significant challenge. The use of antibiotics without proper prescriptions is widespread, both in human medicine and in agriculture, which is contributing to the rapid rise of resistant bacteria. In rural areas, limited access to healthcare professionals often leads to self-medication, where people purchase antibiotics over the counter without medical advice. In urban centers, even though healthcare services are more accessible, antibiotics are still frequently prescribed for conditions like viral infections that don't need them. This overuse is driving resistance to common bacteria, including E. coli, Klebsiella pneumonia, and Staphylococcus aureus. The problem in hospitals. Pakistan's hospitals are facing serious problems with multi-drug resistant bacteria, particularly in intensive care units, ICUs. Infections caused by resistant bacteria lead to longer hospital stays, higher costs, and a greater risk of death. Unfortunately, Pakistan has seen an increase in cases of resistant infections like MRSA, methicillin-resistant Staphylococcus aureus, and drug-resistant tuberculosis. Antibiotic use in agriculture and livestock. Another contributor to the antibiotic resistance crisis in Pakistan is the misuse of antibiotics in agriculture and livestock farming. To promote growth and prevent disease in animals, antibiotics are often administered routinely, not just to sick animals, but to healthy ones as well. This overuse contributes to the spread of resistant bacteria, which can transfer from animals to humans through the food chain. Antibiotics that are critical for human health are being used irresponsibly in livestock, and this creates a breeding ground for resistant bacteria. The consequences of antibiotic resistance in Pakistan. The consequences of antibiotic resistance in Pakistan are severe. Treating resistant infections requires more expensive second or third line antibiotics, which are often unaffordable for many people. As a result, patients may face untreated or poorly treated infections, leading to higher mortality rates. Additionally, antibiotic resistance is putting a massive strain on Pakistan's already overstretched healthcare system. Infections that were once easily treated now require longer hospital stays, adding pressure to the country's healthcare infrastructure. What can be done to fight antibiotic resistance? Now, let's talk about what we can do to combat antibiotic resistance, both globally and in Pakistan. Here are a few key strategies. Improve antibiotic prescribing practices. Doctors need to prescribe antibiotics only when absolutely necessary and based on proper diagnostic tests. In Pakistan, this means better training and awareness for healthcare professionals. Public education. People need to understand that antibiotics aren't always the answer, especially for viral infections. Completing prescribed courses and not self-medicating are essential to slowing down resistance. Strengthening regulations on antibiotic use in agriculture. The government should enforce stricter controls on the use of antibiotics in livestock farming to reduce the spread of resistance through the food supply. Invest in research and surveillance. Pakistan needs more investment in monitoring antibiotic resistance trends across the country, as well as research into new treatments and alternatives to antibiotics. Pakistan has already taken some important steps. The National Action Plan on Antimicrobial Resistance, launched in 2017, aims to raise awareness and implement policies to combat the misuse of antibiotics. However, much more work is needed to curb the growing threat. The fight against antibiotic resistance isn't just for doctors, scientists, or governments. It's something we all have to be part of. Whether it's taking antibiotics responsibly, spreading awareness, or supporting initiatives for better regulations, each of us can contribute to this effort. Together, we can slow the spread of antibiotic resistance and ensure that these life-saving drugs remain effective for future generations.